Hi, welcome to Physio Tribe. My name is Taher Dhuliawala, and I'm a neurological physiotherapist. Today, I will be talking about assessments and holistic management of spinal cord injury patients. I remember when I was studying for my bachelor's, I was not keen on spinal cord. However, treating patients with spinal cord injury has just developed my special interest towards it. So in this part one video, I will be talking about the importance of subjective assessments and how you can make a comprehensive subjective assessment to provide that patient-centered approach for your patients with spinal cord injury. So in subjective assessment, I like to look at four important things. So first thing is patient problems. I like to take a comprehensive patient history. Then I look at patients and do my observation from patient, and then I see patient's expectation. So completing the patient problems, I like to ask patients what are their current problems. So I work in a community setup, and I work in after the patients have had their acute therapy or acute rehabilitation, they come to me in the outpatient or I see them at home. Now, when they are in the acute setup, they have different goals, they have different problems and different complaints. So when they come in the community, their problems might have changed. So it is very important for you to establish what their problems are and then make sure you ask the patient their problems rather than you identifying the problems for patients. And then I like to ask my patients how those problems affect their day-to-day lifestyle, because it is very important to know if the patient, those problems of the patient are affecting them in their daily activities, and then how those problems are affecting them physically, emotionally, and psychosocially. And then you also look into the barriers for these problems, what these barriers could be, if there are there any physical barriers, emotional barriers, or psychosocial barriers. So yes, taking the detail about patient problems. Then I go into a comprehensive history. So the first important thing I would do is reading patient reports beforehand. And this is important because sometimes I have noticed from my experience that when patients go to different professionals like consultants, nurses, and different even physiotherapists, occupational therapists, they have to repeat about their history every time they go, and this can have quite a bit of a psychological impact on patients. So I like to read everything beforehand before I see the patient, so I'm aware about the patient history if the notes and reports are available. Sometimes when some patients come to us, these are not available, unfortunately. So if they are available, I make sure I read them so that I can take a detailed history around the injury, and then you can ask patients about this detailed history and you can verify things what you want to ask. But then when patients tell you that they don't want to share some information, you need to respect that. Okay. The next important bit is taking a detailed medical history. This is very important because when you treat patients, you need to know if there are any problems which are going to happen, or patients have other medical history, or when if you are seeing patients in an acute or community setup, you need to know if the patients have had any autonomic dysreflexia because of their spinal cord injury, or you also need to know if the patient have had any postural hypotension. Again, this will be dependent on their level of injury. Again, taking a detailed history will allow you to know whether the patient is complete injury or incomplete injury, patient their levels, also the extent of the injuries, the severity, all those things, and if the patient has been classified on Asia scale. So you need to know what Asia scale classification they are. So this will help you to prepare or already have certain things in your mind when you are preparing their management, or you need to have these things in your mind when you are assessing the patient as well. Then I like to take a detailed social history about my patient. because I need to know what, when you plan your management, this is a very important aspect. You need to know where patient lives. You need to know what problems patient have in the house, what are the difficulties they're having. Also, you need to know if the patient has got problems with, you know, getting in and out of the bed, how they're managing that. Do patients have any help? Do the family help them? Also, you need to know about if the patient is independent with their personal activities of daily living, if the person is managing to do that, or are they having any help? If not, then you can also look into you can also look into in your management or education, you can look into how you can help patients with that. So a detailed social history is very important. Along with that, you also need to ask if patient has any modifications in the house due to the after their injury, which will help them with their transfers or help them with mobility. Along with that, make sure you also take a detailed history about what patient worked as before, what patient hobbies are, how are they managing their social life, and what would they like to do apart from their physiotherapy or apart from their exercises. So in the observation, first thing is, when the patient, I'm assessing the patient, or when the patient is talking to me, I will look at patient's mood and behavior. Having a spinal cord injury can be quite catastrophic to the patient as well as their family, and their mood will depend on that, and it will also depend on how they have accepted their condition. So it is very important to observe those things, because sometimes patient might not tell you, but you need to identify those problems, and you need to identify that, because it is going to impact the management what you have created for the patient. Along with that, I will also look at patient's posture and see the patient posture in sitting and even in different positions. And then you need to watch out for any involuntary movements, whether when the patient was talking to you, did they have any spasms, did they have any clonus. So this will just help you plan out what you're going to assess in your objective assessments. Last and important thing is patient's expectation. When the patients come to see me, they have come from acute rehabilitation. Sometimes some patients have not been to the a spinal specialist center. So when they come to see me, and if they have not been to spinal specialist center, I need to explore if the patient have got realistic expectation and how educated patient is about their condition. So this is important aspect to explore, and also to set smarter goals. Now, when I was few years ago, I have been working into formulating smart goals, but recently I've looked into from doing courses and some from other colleagues and their experience. I have kind of started to look into developing smarter goals for my patients. And smarter goals are basically being more specific, being more measurable, making sure your goals are achievable or attainable, make sure they are realistic, make sure they are timed, so you have to time your goals. And the ER is basically make sure the goals are earnest, because you need to make sure the goals which patient has made for you, first of all, the patient has their patient goals rather than your goals. And also you need to make sure the patient is going to full-heartedly comply to those goals, because that was something patient want to focus on rather than you are telling patient or the family is telling the patient, which is very important. Along with that, you need to make sure these goals are recorded, because I like to record all my goals so that after a few weeks or whenever we have set a time for reviewing those goals, we can review them back again and look back at it and say, this is what we had written then, and now this is what we're going to do. So the whole management becomes more transparent, patient is in control of it, and patient has a set of goals. This is what I like to do when I'm with my treatment. And also, I know that we talk about long-term goals, short-term goals, but then sometimes for some patients, I like to think about whether putting a long-term goal, is it too early to formulate that? Whether you need to, obviously, every patient assessment is individual. And sometimes you need to think about whether is it too early to formulate that long-term goal, or whether do you need to tell your patient that let's plan some short-term goals in order to reach that long-term goal. So because sometimes some patients come to me and they want to, the only goal they have is I want to be able to walk if they're incomplete spinal cord injury. However, that sometimes is not feasible, because in order to make that long-term goal, you need to achieve some short-term goals. So this is a very important aspect. Okay, brilliant. So this is the end of the subjective assessment, and I'm sure you'll have many other things and many questions about this. If you do have, please make sure you comment below so that, and give us your feedback. If you need something added, we will make sure that we do that. And please follow our other social media channels like Facebook, Twitter, and Instagram. And please subscribe to our YouTube channel so that you can hear about the part 2 and then management. Okay, thank you.